I'm from Fremont, California, which is in the Bay Area. It's just south of Oakland. That's where I grew up. I went to an all-girls high school, and I was very fortunate that that was actually what sparked my love for science. During our junior year biology class, we did a special segment on DNA where we actually got to do PCR experiments. So what we did is we crushed up strawberries and actually got to extract the DNA from strawberries and ran PCR on it. And I just loved it and thought it was just such a cool experiment and application of science. So from there, that was when I decided that I wanted to look at colleges that were science heavy. And so when I went to college, I majored in biochemistry. And then at that point, I was also shadowing in an underserved clinic and with an orthopedic surgeon at that time. And I realized that was the application of science that I wanted to do. I did clinical research for my last 2 years of college, specializing in orthopedic hand surgery. And then went to medical school after that. I did not have as much time for research during that time period. But at that point decided I wanted to specialize in general surgery to do pediatric surgery, which is a more research-heavy specialty. That's another one of the nice things about medicine is that based on your skill set and your interests, there are lots of different options within medicine in terms of the subject matter, things that you can do. Not everything is patient-based. If you go pathology or radiology route, that you don't see patients every day with those. And then there's the other things like medicine, pediatrics, surgery, where you see patients all the time. And then especially for me, when I decided I wanted to do pediatric surgery, these are your kids from the day they're born until the day they turn 21 and they move on to adult care. And I really liked being able to follow their lives and see what wonderful things they do. So I work for Dr. Eugene Kim, who is a pediatric surgeon who does research in neuroblastoma, which is the most common abdominal tumor that kids get. And this is a very important tumor clinically because it has a very high mortality rate, unfortunately, despite chemotherapy and surgery. And what we work on is we are currently working on cancer stem cell research. We have a population of cells that we think may be self-renewing and may be escaping chemotherapy and radiation effects. And so we're studying that population of cells to try to better characterize it and guide treatments for that. In generally, regardless of what you go into, residency and medical school are very challenging. And so it's very time intensive, not only for you, but for your family and everyone who kind of travels that path with you. And then again, the patients that you see, you become very involved in their lives, and learning to emotionally handle all of that is also a challenge as well. I think one of the things is to just keep pursuing all the different opportunities that there are in science, learn about all the different things that you can do in the field, get exposed to biology, chemistry, physics, see what you like and what you don't like, and pick an area that you're interested in. That's the first piece of advice. Do what you love. It makes a big difference. It makes those long hours and difficult patient days, it makes it worth it. And then the second one would be find a mentor, find somebody in that specialty that can help guide you and provide recommendations. I know I would not be here today without the string of mentors that I've had since high school.